Okay, here are some common questions you're going to get asked before they go to swab. They're going to say, am I eligible to donate? First question they're going to ask, typically, age. The answer is that we start swabbing individuals from 21 and up. We don't swab under 21, and the truth is that young ladies, we strongly discourage from donating their kidney. When they're entering into childbearing years, or they're in the early parts of their childbearing years, they should not be donating their kidney. If they're towards the end of childbearing years and they're only planning on having one or two more kids, then studies have shown that it is safe for them to do so. But there have never been any studies prior to that, and therefore we're not comfortable with it until there's a study that shows that this is something that is safe. Another question that gets asked is, what if I have an illness? Well, that depends on the illness. If somebody's diabetic, they cannot donate. If they're pre-diabetic, they cannot donate. If both parents are diabetic, assuming that it's genetic, so then they cannot donate. If they have a history of kidney stones, well, that's going to depend on the details. Was it one episode of a kidney stone a while ago? That's going to be fine. If it's many episodes, that's where they're going to be disqualified. There are a lot of red flags, a lot of things that are questionable, which they ask you may not know the answer. First of all, the digital form will sift out those that are not eligible, so they can start the form and see where it goes. But just to give you a couple others, if they're taking multiple medications for high blood pressure, more than just one, that's also going to be a disqualifier. And there are a number of other things. So these are questions that will be asked. The other main criteria is if they are significantly overweight, they are not eligible to donate their kidney. The typical numbers that we use, if they want to know, they can look up Google BMI calculator, body mass index, and figure out what your BMI score is. Typically, we're looking for a BMI under 33. Every hospital is different, so sometimes there's a little bit of wiggle room on it, but typically under 33 is what we're looking for. The other thing to keep in mind is they're going to ask you, when will I know if I'm eligible to donate, or if I'm a match to this particular person or to somebody else on the list? The answer is, it takes about 5-6 weeks for the lab to send us back the results of this swab, and then we go and we start calling the people who are the best matches. So if you don't get a call, it doesn't mean that we lost your swab. It means that you're just not the best match for somebody at this time. But you could always feel free to give us a call and find out where it is in the process and what's going on. But again, thank you so much, and Hatzlacha Rabbah.